My name is Lotta ERIKSSON. I'm head of the secretariat of the Swedish National Council on Medical Ethics. This short presentation is for the NEC Forum Conference website. I will briefly tell you about the Swedish Ethics Council's work on COVID-19. It is the Swedish Council's view that we have a moral responsibility to learn from the crisis. What decisions should politicians and authorities take, and when? The answers to these questions have ethical dimensions. Decision-making during a pandemic is not based solely on facts and scientific evidence. Choosing between different courses of actions requires the decision-maker to weigh in a range of values and value-related conflicts. Ethical analysis is crucial in both the preparation and response phase of a pandemic. So what has the Swedish Ethics Council been up to? At the start of the pandemic, concerns were expressed that Swedish hospitals wouldn't have enough capacity to treat all who could become ill, especially regarding those in need of intensive care. In the beginning of the pandemic, the Council immediately started discussions concerning priority setting in intensive care under extraordinary conditions. The Council concluded that the ethical platform for priority setting in Swedish legislation should be applied. The ethics platform for priorities in healthcare is based on the principles of human dignity, needs and solidarity, and cost-effectiveness. It follows from the principle of human dignity that everyone must be treated with respect and on equal terms. Age, disability, and social function cannot and should not be valid criteria when to decide who will and who will not get access to healthcare services in times of limited resources. The need and severity of the condition and the prospect of prognosis and effectiveness of the treatment should be guiding criteria. The Council also stated that it is important that the health service is open about exactly what is being prioritized and on what basis. It is also essential to be clear about when different guidelines for extraordinary situations should be applied, when they should no longer be applied, and how this should be communicated to those making the decisions. Healthcare professionals must ensure that the guidelines are applied at the right time and not too early before demand has outstripped the resources. Swedish hospitals were eventually, in a short time, able to double the number of intensive care beds, and the maximum capacity has so far never been exceeded. But now there are worries in the Swedish society that people have not been given a fair chance to access to healthcare services, and that priority settings have been made out even though there has been available capacity. For example, there have been reports in Swedish newspapers from relatives to elderly patients about how they had to fight to get their elderly relatives access to healthcare. Now, different authorities are looking into this to sort out what has happened. I think it will be an important task for the Swedish Ethics Council to follow up how priorities have been made during the pandemic. The Swedish Council has published the report Ethical Choices in a Pandemic. This is the Swedish version. This is an overview of the core ethical values, problems and challenges that arise in a pandemic. The report also includes general recommendations and proposals. We hope this report will contribute to a deeper understanding of the ethical dimensions of the COVID-19 crisis and how ethical analysis can be used in decision-making during a pandemic. The target group for this work is decision-makers at various levels and the interested general public. The report was written within a short time frame by a working party by 4 expert members and myself. An English summary of the report can be found at our webpage, smer.se, and on the 15th the full report will be available in English. In the report, the Council recommends the Government and Parliament to develop a more robust contingency plan, including an ethical framework for decision-making in the face of future pandemics. The Council outlines the values and principles that can form the foundation for such a framework. This foundation may need to be revised moving forward based on experiences from the ongoing pandemic. The report deals with several topics besides guiding values and principles for decision-making, like global ethics, international solidarity, different kind of public health strategies, tracing apps, and immunization certificates. It also, of course, includes ethical challenges within healthcare, where we focus on priority setting and ethical aspects concerning quality in the end of life and the importance of having the opportunity to say a final goodbye. The report also includes discussions on experimental treatment and research ethics in the time of a pandemic and the importance of communication. During this process, we have closely followed the work of our colleagues in other national councils in the European Union and worldwide. We are looking forward to getting feedback from our European colleagues on our work, and we would like to find ways to collaborate with colleagues from other NECs about lessons learned from the pandemic and how we, as ethics councils, best can support other governments in developing ethical frameworks for the future. Thank you for listening.